I present a randomized controlled trial of Polatuzumab vedotin together with bendamustine and rituximab versus bendamustine and rituximab alone in patients with relapsed refractory follicular lymphoma and DLBCL. So Polatuzumab is a drug conjugate that targets CD79B, which is universally expressed on follicular lymphoma and patients with diffuse large B-cell lymphoma. In this study, it was a 1-to-1 randomization of patients treated with Polatuzumab combined with BR versus BR alone. So patients were eligible if they had relapsed refractory follicular lymphoma or DLBCL. The patients with DLBCL had to be considered transplant ineligible to participate in the trial, so a very high-risk cohort of patients with DLBCL. Ultimately, the trial randomized 80 patients with follicular lymphoma and 80 patients with diffuse large B-cell lymphoma. In terms of the safety parameters, so overall, the combination of Polatuzumab and BR was quite tolerable. There was an increase in the adverse events that was noted with the triple combination, but these were largely low-grade toxicities, including peripheral neuropathy, which were largely manageable and reversible. In terms of the higher grade toxicities, it mainly pertained to cytopenias. So there was a higher rate of grade 3 to 5 neutropenia and anemia seen with the combination of Polatuzumab and BR versus BR alone. A slightly higher rate of febrile neutropenia, but despite this, there was no increase in the incidence of grade 3 to 5 infections seen. In terms of the peripheral neuropathy, this was largely low grade. There was only one patient who experienced a grade 3 event, and the peripheral neuropathy was largely reversible, as I said. In terms of efficacy, what was seen in patients with follicular lymphoma, now the primary endpoint was PET CR rate at the end of induction. In terms of follicular lymphoma, there was really no difference between the groups because the PET CR rate was actually notably quite high for both Pola-BR and BR-treated patients. And at the time of follow-up, which is still relatively short for patients with follicular lymphoma, there was no apparent difference in progression-free survival or overall survival. However, for patients with diffuse large B-cell lymphoma, the primary endpoint of the trial of PET CR rate at the end of induction was markedly improved in patients receiving the Polatuzumab. So it was 40% compared with only 15% for patients receiving BR alone. And this translated into a significant improvement in progression-free survival. So progression-free survival, the median progression-free survival was more than 6 months with the Pola-BR compared to only 2 months with the BR, which translated into a hazard ratio of about 0.31. And quite remarkably, there was actually an improvement in overall survival. So patients receiving the Pola-BR had a significantly improved median overall survival, which was over 11 months for the triple combination versus approximately under 5 months for patients receiving BR alone. And again, with a hazard ratio of 0.35. So really what we learned from this study, which is a randomized phase 2 cohort, is that at least for diffuse large B-cell lymphoma, Polatuzumab showed a marked improvement when combined with bendamustine and rituximab for this high-risk, difficult-to-treat population.